I'm really excited to talk to Dr. Shannon Clark. She is, if you don't already follow her, she has an incredible account and it's filled with tons of information. She does awesome videos that just get right to the truth about things. She's here, and if you go and request Shannon to join the convo, then we can go live. Anyway, we're going to talk all about her story, infertility, IVF, and just going off the conversation we had last week with Ashley Spivey, which was awesome and so important. And yay, here we go, I think. Hi.
Hi, good morning.
Good morning. I feel like I spend so much time watching your videos that this is like a surreal moment.
I know. I'm actually in Seattle for vacation. My husband is from Seattle, Tacoma area. And I was in Pike's Place Market with my twins by myself. And, I don't know if you've been, it's a little crazy. And someone just grabbed a hold of me and she's like, you're on TikTok.
That is amazing. I mean, let's just start with that. I mean, what has that been like for you? Because you've, grown so much on your social channels. You do these videos, which are really, I found when I found you when I was pregnant with my second daughter, just to be such a relief to find an account like yours. It gets right to the point. There's so many things going around that are so anxiety causing and stress inducing. And to have an account like yours really at any phase of life, and for me especially during pregnancy and postpartum, was such a relief. And obviously you've gained a huge amount of traction and notoriety in the space. So can you talk just a little bit about how that came to be?
So I joined social media years ago. I had my twins in 2016 and I started my infertility journey in 2014, but I wasn't really doing anything with it. I wasn't really educating, if you will. But once the pandemic hit is when I really started educating and being an advocate about what people need to know about COVID infection and vaccine and pregnancy. And then came with it was all of the social media, medical misinformation, targeting pregnant and trying to conceive individuals. And so how I kind of gained this profile as a fact checker debunker, I think it's because I'm willing to address it. And it's not easy. It comes with a lot of negative attention. I've had to increase security around my home. I've had to put certain measures in place because people don't really like being called out. But I feel like as someone who is an expert in my field and seeing all the medical misinformation that specifically targets pregnant and trying to conceive individuals, somebody has to try. And I can't keep up with all of it. But, it's important that we actually counteract that is the bad information as much as we can with the actual facts and why we do what we do, and at the same time arm followers with information so that they can advocate for themselves. So that's what I'm trying to do. I didn't see myself ending up in this role, but it is what it is, and I try my best to pick the most blatantly false medical misinformation to address.
I mean, it's really crazy when you think about how much information is put out there just simply not true.
Yeah.
And, oftentimes is put out just to cause anxiety, to cause, stress, especially in the group of pregnant people or trying to conceive people, which are, oftentimes the most vulnerable.
Yes.
You're already on edge, you're already stressed out, and you're also already trying to do your best in the time and in the space given. Can you talk about just the response from people who are in those more vulnerable spots in life that have really had such a huge response to what you're doing and kind of the help and ease that you're giving that group of people?
Yeah, no, the response is overwhelming. I get a lot of thank yous and I appreciate this and keep doing it. Please don't stop because we need someone. And that's what keeps me going. I mean, the positives of it far outweigh any negatives. It just makes me feel bad because I was one of those people. And yes, I am a medical professional, but I was still a person undergoing infertility. And I still didn't know a whole lot about that space. And so I could see how people can see some of this information. And I wish, when I first started doing this, I thought, well, maybe these people just really don't know. And they think they're putting out correct information, but they're not. And I've come to find out, I think they do it because it benefits them. You know, if it will send them or draw that traction, those followers to their link in bio where they're selling some kind of supplement to magically cure decreased egg quality or magically increase your egg count, that's profitable for them. So I come to the conclusion that a lot of these accounts know exactly what they're doing. And when you, just like you said, people who are trying to conceive for whatever reason, or they're trying to conceive and they're experiencing infertility, or they're trying to conceive, experiencing infertility and their advanced maternal age, they are willing to do or try anything, especially when it's been a year into this, 2 years into this. And so they see this as a lifeline. Maybe if I do this supplement, but unfortunately, they're not always well-intended accounts, and they do that for a reason. And so there's some of us on here who will absolutely go through, and whether it's something that people want to hear or not, showing what the evidence, or educating on what the evidence shows, and counteracting that misinformation is key. Just like recently, a colleague of mine, Dr. Lucky Sikon, who is an infertility specialist, we talked about these posts that were going around that everything we've been taught that individuals are born with all the eggs they'll ever produce is not true. But these people were using studies from naked mole rats and prosimians, and there's nothing in humans that shows this. And I wish it was true, because if it was, I wouldn't have had to go through what I had to go through to become a mother. But what it does is provide false hope. And every one of those accounts directs their followers directly to something they're selling, and so it benefits them. And so I wish I could tell people, yes, we do keep producing eggs for our entire lifespan, like the naked mole rat, but that's simply not true.
Right.
So while it's a hard pill to swallow, we are still responsible as medical professionals to provide, if we're on social media, to provide accurate evidence-based information.
And just for people who might not know your full story and how you ended up being so passionate in this space, especially, you decided to get pregnant later in life. You were pregnant at 42 with a donor egg. Can you talk just a little bit about your experience, since we're focusing a lot on infertility and people's fertility struggles, especially in this month? Maybe we can just talk a little bit about your story, and then I want to get to some questions, because there were a lot of them, but just about your experience and your journey with fertility.
So I am the typical medical professional overachiever who, I was single all the way up until 38, right after I turned 38, and that's when I met my now husband. He was also 38, we're a month apart, and we were married within a year and a half, and I really focused on my career. I was training for 25 years. I mean, that's what I was focused on. But once I met him and we both decided that we wanted to start a family, I knew that it might be hard, but I was healthy. I didn't drink, I didn't smoke, I exercised all the time, I had a great BMI. I ate really well. So I thought, well, maybe it won't apply to me. So when I started to get, to try the good old fashioned way at 39 going into 40, the very first time I got pregnant was a miscarriage. And then I panicked, because now I'm turning 40. And I went to my friend who's a fertility specialist, and I said, just educate me as if I am not in the medical profession. And my husband was right there, and he showed us the stats, and we both were like, I'm now 40. We went straight to IVF. I went through 5 cycles myself. I did produce a lot of eggs. I did. On all those egg retrievals, spat out of, I think there was, I always forget the number, 20 plus that were actually made it to where the embryos could be genetically tested. 1 was chromosomally normal out of all those. Wow. And that is simply due to my age, not anything I did, simply because of ovarian aging and the poor egg quality. So all the other ones that got genetically tested were all chromosomally abnormal. We did transfer that 1. It resulted in a miscarriage. Then very quickly, I'm now almost going into 41, 42. We decided to do egg donor. And that's a whole nother process that, I won't go into here, but that's what we decided to do. And if anyone's listening thinking it was something that was hard for me to do, I think I just had to quickly overcome any feelings of loss at having my own genetic contribution to my hopefully children that I would have. I did have to go through that. It's a little bit of a mourning period, but I wanted to be a mom. And it was also important for me. I wanted to experience pregnancy, because that's what I did all day, every day. I took care of pregnant individuals. I wanted to experience that. And I was blessed to have the financial means to do that. And I fully recognize that not everybody does. And I understand that. But ultimately, we got 5 embryos from our egg donor. We transferred 2 And single embryo transfer is what ASRM recommends, and I fully support that. The reason why I did two is because of my age. I was 42, and I had multiple failed transfers. So there are some fertility specialists in those types of situations who would say, yes, you could transfer two, but there are multiple reasons why single embryo transfer is best. That first transfer, two embryos failed. That was probably the hardest part of my whole entire journey, because I thought, well, now I have an egg donor. Everything's going to be fixed, right? I'm going to get pregnant. And it didn't happen. So then I had two more in that, transferred two more, and ended up with my twins. Now, my pregnancy was very complicated. I had every complication you could possibly have from being advanced maternal age, IVF, infertility, twin pregnancy. But thankfully, I delivered at 31 weeks, and now they're almost 7. So I've been through it all as a medical professional and as an infertility patient. So I've experienced just about everything you can experience.
Wow.
Yeah.
I mean, there is, of course, benefits to coming from your professional field as a maternal fetal medicine specialist, just because you are, experienced in the space, you interact with people who are on a similar journey, and also it's different when it's going on with you personally, and also in your relationship and in your marriage, and you're wanting to become a mom on your own. How did you, stay so hopeful and on the whole journey to get to be a mom? Was it just that you were so set on becoming a mom yourself and you just, went through it? Because it is, from the feedback that I have from friends who are on this journey is that it's exhausting in every single aspect of life, and remaining hopeful in those miscarriages and in those failed transfers is really challenging.
Well, I think it's definitely financially, emotionally, mentally, and physically draining. No question. I will be honest. I don't think that I was always hopeful, but I think because of my personality, being someone who is professional, who had been to school majority of my life, and every goal that I've set out to accomplish, I was able to achieve with a lot of hard work and focus. I just kind of took that mentality into this, and it benefited me in some ways, and it probably didn't benefit me in some ways, because I didn't allow myself some healing time or downtime and all of that. And I was just go, 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 go. And then it eventually caught up with me later. So yes, definitely there's some benefits to having the type of personality I have, and being an overachiever and someone that's accomplished a lot when going through this. But there's, a few downsides as well. And I'll be completely honest about that. But as far as remaining hopeful, that's probably the hardest thing to do, because there are some really dark days and some really low lows where you just think, I did everything right. I was healthy. I've been helping pregnant individuals my entire career. Why is this not happening for me? And it's hard to sit and think about, have those thoughts. So I just poured myself into work. And oddly enough, during this whole process, I'm in academic medicine. When I was going through 2 years of IVF, I was on hospital bed rest for 2 months, and then out of work for 6 months. I accomplished enough to be promoted to professor. I'm not even kidding you. I don't know how I did it. And I was like, I went through all of this in the typical 5-year span to go from associate to professor. And I was going through that, and I still did enough to accomplish that. That just tells you how some people are just so laser focused. But again, eventually it's all going to come back, and you're going to have to go through it at some time, like I have in the subsequent years. I still have to face all those traumas and all the ways that I felt before that I was able to push to the side. Those feelings don't stay pushed forever. So eventually they do come out and they have to be addressed. And that's what happened with me, but it just happened later down the road. But yeah, it's a pretty crazy journey to go through something like that and be in the profession at the same time.
Yeah. I'm sure there's, as you're saying, pros and cons to knowing so much and then and so experiencing it. So when it comes to fertility, I think the number one question that, for anybody in this space, whether you haven't reached a challenging point in your fertility journey or you're about to start it or everything's going well, I think that the overall biggest question is, what can you do or what steps can you take to increase your fertility?
So I wish there was, and just keep in mind, I'm not a fertility specialist. This is coming from, what I'm going to say is coming from my own education, and then also educating with my colleagues here. To increase your fertility, I think it starts early on. Being up to date on your well woman exams or well individual exams. If you start getting to that point where, you know, I'm probably going to be delaying childbearing, which is fine, absolutely fine. We don't have to have children in our 20s anymore. We can pursue careers, we can travel. But once you start getting to that age 30 and plus, see your OBGYN. Talk to a fertility specialist just as a curbside. Hey, I'm thinking about delaying childbearing until age 35 plus. I'm thinking about delaying until 40 plus, to get those stats and know where you stand. There's no magic test. There's no magic supplement that can make everything be okay. You can get some advice, especially from a fertility specialist who could talk to you about what your overall health status is and give you some recommendations. We underutilize that, I think, in general, way too much. We assume, because we're not thinking about it at the time, is I'll address that later, but what we don't understand is that some of the things that happen in our 20s and 30s, especially if we start to develop high blood pressure, diabetes, or other medical conditions, that could potentially impact our future fertility. So having any kind of chronic medical condition adequately controlled, being as healthy as possible, understanding that there is not a magic concoction of supplements that you can go to the store and buy that you take every day that's going to make everything okay. But I think instead getting advice from the people who do it day in and day out, and those are fertility specialists, the REIs. Just going to see them as a consult can be invaluable, because they can look at you where you stand today at age 25, at age 30, at age 35, and say, these are the stats, this is what I know about your medical history, and this is what you can do, or this is what I recommend. I do think that's underutilized, and I know people get scared. I don't want to go see a fertility specialist. They're going to sign me up for IVF. That's not true. They're very willing and they want to educate people. And I know a lot of my colleagues are so thrilled when they have those consults where people are being proactive about their fertility. So that's the best way, I think, to help your fertility, is be in the know and know where you stand. Those are the two important things. And don't assume, please don't assume, anyone that's listening, that just because your sister, your mom, your aunt, your cousin had children past 35 and 40 with no issues means that you will, because fertility is not inherited. You don't inherit the ability to have a child or later in life. That is very dependent on the individual. So please make sure that you don't assume anything when it comes to your fertility.
For women who are after 35, is it any age after 35 when you're pregnant, is that considered advanced maternal age?
Yes. So, and it's called other things, but we're not going to say those other things. I think the most nice way to refer to it is AMA, or advanced maternal age. I try not to use any of the other terms. Yes. And there's been some on social media where people say that's outdated, that's not true, blah, blah, blah. It's true. And I'm sorry, but it's true. ACOG just came out with a new, I don't know if it was a practice bulletin or a consensus opinion on pregnancy after age 35. 35 is still considered advanced maternal age, based on the fact that there's an increased risk for having decreased egg quality and egg quantity, which can increase your risk of pregnancy loss and having a fetus that's affected by a chromosomal abnormality. Now, that's on a continuum. It doesn't mean that when you turn 35, bam, it hits you. It can occur a little bit earlier in some people, and it can occur later than others. But 35 is the general age where we really start to worry about advanced maternal age. And then things really take a drastic turn at age 40, and that cannot be ignored. So anyone that's thinking about delaying childbearing until after age 40 has to be in the know about those risks as well. So I mentioned the chromosomal abnormalities and pregnancy loss, but the other thing is that as we age, we start developing chronic medical conditions like diabetes, high blood pressure, other chronic medical conditions that might occur. So that can affect our general overall health, which could also impact our fertility. So we have to keep that in mind, that we age just like everybody else and are likely to develop medical conditions just like anyone else. And we can still get pregnant, but those medical conditions can either A, impact our fertility, or B, impact our pregnancy once we do become pregnant. So all of those things have to be considered once you start to approach age 35.
When it comes to egg quality, you're saying it changes after 35 in women. Is there anything that happens after a certain age for men for their sperm quality?
Yeah, there is such thing as advanced paternal age, but that's not until I believe it's either age 50 or 55. I think it's age 55. And that is where they start to have increased risk of genetic disorders in the offspring as well. You think about the long and the short of it, having something called Marfan syndrome is one thing. The other one is having different types of disorders of short stature. could also be a risk of having advanced maternal age. And then you think about as far as genetics go, but there's also things too, the overall health of a male or sperm contributing individual to the pregnancy can also impact the health of the fetus. We know that neurodevelopmental disorders are increased with both advanced maternal age and advanced paternal age. So we are getting more and more information on that. But that generally happens, unfortunately, well, for whatever reason, and as males or sperm contributing individuals get older, not at age 35.
In your space, I assume also you deal, and I'm sure you can relate to this having gone through it, with a lot of anxiety in your patients. Just, constant worry about getting pregnant, staying pregnant, how to maintain a pregnancy, especially if you're over the age of 40. What is something that has been helpful that when it comes to advice or just recommendations that you give to your patients who are experiencing a lot of anxiety? Because how to deal with anxiety was definitely a common question with the best.
So dealing with anxiety, I'm just going to qualify this. Where I work in academic medicine. So my patients are largely indigent and underprivileged and on state funding. So I don't have a lot of patients who have become pregnant through assisted reproductive technology or IVF. But I do have a lot of patients who have become pregnant after age 35 and 40 spontaneously. And a lot of them do have chronic medical conditions that are poorly controlled because they did not get adequate medical care in between pregnancies. So I think the best thing to do, if it's a planned pregnancy, the best thing that you can do to help the chances of the pregnancy proceeding as healthy as possible is to have any chronic medical condition as best controlled prior to conception as possible. Namely, and we'll think about the most common two, diabetes and hypertension. If it's not, and you find that you're pregnant, that's where someone like myself comes in. I can try to play catch up and get you under control as best as possible. Sometimes it's not that hard, and sometimes it's very hard. But that's not the best time to play catch up. We do the best that we can for these chronic medical conditions, getting them under control. But ideally, a planned pregnancy, as much as possible, is preferred because we can do all that legwork before the pregnancy even occurs. But if it's not, we can try to do our best while you're pregnant. As far as the anxiety, I had anxiety myself. I'm not ever going to tell anybody, don't worry, you're going to be fine. It's hard to tell people not to worry. But I think education and knowledge is key. Getting the prenatal care, doing what your doc recommends. If you're over age 40, I do recommend asking to see a maternal fetal medicine specialist like myself if you're going to a general OBGYN, because we can assess to see, do you need that baseline EKG? Do you need echo of your heart? Do we need to assess for other medical conditions because you haven't had the most prenatal care or the most care in between pregnancies? Is there anything else we need to do to work you up to make sure that we're not missing anything? And this is more applicable to those over age 40. What can I tell people to not have anxiety? I wish I had this magic sentence. The one thing I have said that I think helps some people is that even if your pregnancy is high risk, doesn't mean your risk is high. Mm-hmm. Being over age 35, being over age 40, you are a high risk pregnancy, like it or not, even if you're healthy going into the pregnancy, because even healthy individuals over age 35 and especially age 40 are predisposed to certain medical complications of pregnancy just based on age alone. But that doesn't mean that your risk is way through the roof now that you're over age 37 or over age 39. But we as obstetricians and high-risk specialists or pregnancy specialists have to know this patient is age 40, 41. We have to really pay attention to X, Y, and Z. We need to do these things differently in their pregnancy. We need to think about delivery at this time because of age alone. So age alone is something that we have to consider whether the patient likes it or not. And some people really get mad at me when I say that because they're healthy and they exercise and they have no diabetes, no hypertension. But we cannot discount age, especially over age 40.
When would it be recommended for someone to come and see somebody like yourself that's in your specific profession? Obviously, as you're saying, it's ideal to have, a lot of the things done prior to getting pregnant. But for someone who might not know or be aware of like, oh, I should come and see, a doctor like yourself right when I think of getting pregnant, when is that the best time?
So if we're still kind of talking about the patients over age 35, if you are thinking about trying to become pregnant, if you've had pregnancy losses in the past, if you've had preterm birth or cervical insufficiency, which resulted in a preterm delivery or a pregnancy loss, if you have a heart condition, if you have hypertension that requires medications, if you have a history of genetic disorders in your family. Coming to us for a preconception consult, which is also underutilized a lot, where we can talk to you about all of your medical history, any pregnancy history you might have had in the past, what happened with your deliveries, and see how they might impact this next pregnancy. And then also add in the fact that you're now advanced maternal age. We can give you some advice on that. So please think about seeing someone like myself for a preconception consult if you can. Now, if you're already pregnant and you're going to a general OBGYN, general OBGYNs are very good about consulting us when necessary. A lot of times if you're over age 35, or pretty much every time you're going to get a different type of anatomy scan, it's called a detailed anatomy and fetal echo. You're going to be offered that prenatal genetic screening testing. And typically those ultrasounds are done in an MFM's office. So you will get typically get a face-to-face encounter with someone like myself during that time period. We may not be formally consulted, or we may not be involved in your care because your OBGYN has decided that, deemed that you don't really qualify for that. But if you're concerned, you could always ask your OBGYN, do I need to have a consult with an MFM, or do I need to be co-managed? A consult means we see you, we give you some recommendations, and we send you back. Co-managed means you're still seeing your general OBGYN, but we're also involved in your care and also your delivery planning. Or sometimes patients get completely turned over to the MFM for care because their case is particularly complicated. So those are 3 things that can happen. So you can always ask your OBGYN if there's a role for MFM care in your pregnancy.
Got it. And there are some people asking questions, and also prior to doing the live, just about the kind of, and I know you talk about this on your page, the natural or homeopathic ways of increasing fertility, getting pregnant, maintaining pregnancy, things like acupuncture, supplements, certain things like that. What are your thoughts on that?
As far as getting pregnant?
Sure, getting pregnant and then just maintaining a healthy pregnancy.
So I've had conversations a lot with some of my REI besties. And really the only thing that has evidence by potentially helping with fertility would be CoQ10. Again, I don't prescribe it because all my patients are pregnant, so that's something you could potentially take. But as far as a concoction or all these other things that people say you can improve egg quality, none of that has been proven. I think the best thing to do is talk to someone that knows, like a fertility specialist. And more is not better, meaning going to the GNC store and asking someone, what can I do to increase my chances of getting pregnant? Well, take this, this, and this, and you're taking a whole, counter full of supplements. Just because it says it's natural, that doesn't mean it's good. A lot of those things are not tested, and we don't know what the side effects are or the consequences are of taking one of them or a whole bunch of them together. So you can't assume just because it's holistic or it's natural that it's going to be good for you. Because again, those supplements don't have to be studied like medications do. So we don't have that kind of information. So again, as far as what you can do to increase your fertility, I think your overall general health has to be the best. And also it's important that in order to spontaneously conceive, having regular menstrual cycles, monthly menstrual cycles is key. If you're not, you have to find out why. I was on labor and delivery one day, and there was a resident who was late at night, and she said, she knew I was on social media, and she was a resident in a different department. She's 26, 27 maybe. And she says, well, I only have periods about every 3 to 4 months, but my OBGYN told me, oh, don't worry about it. When you decide you want to get pregnant, we'll just give you Clomid. And my jaw dropped. I'm like, no, we need to know, why are you not having normal periods? You can't just throw Clomid, and people get that a lot, which is an ovulation induction type of medication. Mm-hmm. It's oral pills for those that are unfamiliar. It is very successful for some people, but it's not something you just say, don't worry about why you're not having periods every month. We'll just give you Clomid when the time comes. That is not good medical advice to give to anyone, especially as an OBGYN. And I told her, you have to find out why you're not having regular periods. That's the first thing you need to spontaneously conceive and have fertility. If you're not, you've got to go to somebody who can do the proper workup to find out why. Don't ever let any physician tell you not to worry about it, because your menstrual cycles are kind of like a vital sign. We think about our temperature, our heart rate, our respiratory rate, all those things. Having a normal menstrual cycle is essentially a vital sign in someone that has a uterus. So we have to make sure that we start with the very basic of having a regular normal monthly menstrual cycle before we even think about our fertility. If that's not happening, happening, then you have to figure out why.
Is that at what phase of, let's say you try to do IVF, you have a successful pregnancy and you're advanced maternal age and you want to have another pregnancy? This was a question that someone had written in. At what point do you need to wait in between pregnancies or wait for your menstrual cycle to come back?
Well, so I think about, a lot of times I hear IVF pregnancy, advanced maternal age. Again, if you're not wanting to get pregnant again later, the ideal inter-pregnancy interval would be 18 months. That's when pregnancies have the best outcomes for anyone, no matter what age. But if you're advanced maternal age, especially over age 40, are you going to wait 18 months? Right. Probably not. So if it was a vaginal delivery, I would say, wait till you're ready. Number one, you're ready. And there's no magic. You need to have 3 month menstrual cycles. You need to have 6. Make sure that you're healthy. You're ready to conceive and try to conceive. When you've had a C-section, that's a little bit different because we want that scar on the uterus to have a chance to heal. I would love to tell everybody, I would love to have everybody wait 18 months, but that's simply not going to happen. So if you're over age 35 or over age 40 and you conceive via IVF and you had that pregnancy, delivery via C-section that you're wanting to have another child, and one of my colleagues is actually in that situation, and she didn't wait 18 months, but she talked to her OBGYN and her high-risk specialist, and they looked at her overall and said, 12 months is okay, but that's between them. That's not something I can do from here, but that's a conversation you can't have with your obstetrician to see what's the minimum time to wait in between pregnancies if you did deliver that last pregnancy via cesarean section.
Yeah, so it's very specific to each person and their kind of healing process and birth story.
Yes, yeah.
Well, thank you so much. This was so informative, and we got to some questions, but I think there are so many, especially in the fertility space, and I know you have amazing colleagues, so it's, there are so many questions about fertility, about egg freezing, and obviously your profession is such an important one and such a huge support system for so many women and couples that are going through this experience. So thank you so much for all the information and for all that you do, all these videos that you do. They're just like getting right to the point, cutting to the chase, and helping ease a lot of people's nerves and mind in whatever phase of life or fertility they're in. So thank you so much.
Well, thank you for having me. Well, thank you. I appreciate the opportunity.
Thank you. You'll have an amazing day and enjoy your vacation.
Alrighty. Bye-bye.
Bye.